While vaccinations are trending in the right direction, the struggle continues for hospitals across Mississippi to treat these COVID-19 patients.
Another obstacle they're facing is a global shortage of one of the drugs that has helped reduce patient deaths. WCBI's Stephen Pimpo talks with doctors and pharmacists about the challenges of treating COVID, and he joins us now live in the studio with the story.
Audrey, Joey, tocilizumab is an arthritis drug that the FDA approved for emergency use back in June. Now with supplies running low, healthcare workers face yet another challenge as the pandemic drags on.
One of the challenges we face is how do we treat patients in a consistent fashion.
As hospitals across Mississippi and around the country continue to deal with the high number of COVID-19 patients, yet another one of their resources is running low.
Sometimes either those medications or our testing supplies have come at risk. And most recently, we have one of our medications that we use with severe respiratory dysfunctions that has a threatened supply chain right now.
The FDA approved tocilizumab for emergency use back at the end of June. Now, 2 months later, a global shortage of the drug has drawn the concern of the World Health Organization. The WHO says tocilizumab can play a key part in keeping patients alive and reducing the need for medical ventilation for the severely ill.
Very similar to the hydroxychloroquine families used in the rheumatoid arthritis.
So Mississippi hospitals must rely on alternatives.
The steroid inhalers, the steroid packs, the antibiotic packs.
North Mississippi Health Services Chief Medical Officer Dr. Jeremy Blanchard says their hospitals have algorithms or procedures to help guide them in choosing the best treatment for a patient.
What they are is if A happens, you do B, and if B happens, then you do C. And it's based on a positive test and a set of symptoms that says you have COVID.
Dr. Blanchard says the best way to treat COVID is still not to get it.
If you were going to look at what evidence do we have that really has been effective in treating and managing COVID, the three biggies that come up first are going to be vaccination, masking, and monoclonal antibodies.
The WHO is currently working to expand the number of quality-assured manufacturers of tocilizumab across the globe.